Hello friends, welcome to my channel Guru Ramdas Educational Society. Today I am Dr. Jagjeet Singh. I would like to talk about pneumonia. What is pneumonia? Pneumonia is an inflammatory condition of the lung of small air spaces called alveoli. Now, what are the risk factors for pneumonia? The main risk factors and predisposition factors for pneumonia are COPD, bronchial asthma, cystic fibrosis, history of smoking, infections, viruses, and different kinds of comorbid conditions like heart attack, cardiac failure, ischemic heart diseases, blood pressure. So, these are the predisposition factors for pneumonia. Pneumonia is caused by different kinds of bacteria, viruses, and it is through aspiration. Firstly, I am talking about bacteria. Which bacteria are responsible for causing pneumonia? Streptococcus pneumoniae, Klebsiella pneumoniae, Chlamydia psittaci, Chlamydia pneumophila, and different kinds of bacteria like Legionella pneumophila, and multi-drug resistant bacteria like methicillin resistant Staph aureus, methicillin multi-drug resistant Streptococcus pneumoniae bacteria. So these bacteria are mainly responsible for causing pneumonia. Now, what is the pathogenesis that is involved in pneumonia? All bacteria are not harmful, they are harmless. 70% of bacteria are present within the human body in different parts of the body, like in colon there are microbial flora, in throat, in nasal cavity there are microbial flora. So these microbial flora, when disturbed and under unfavorable conditions, they can descend into lung, especially of throat and nasal cavity, and that can trigger an inflammatory response in the lung, and that is known as pneumonia. Suppose if bacteria are found within the lungs, within the interstitium of the lung, within the air spaces between the lungs, that can produce neutrophils. So there will be million number of neutrophils which will be present within the lung, and those neutrophils will fight against those bacteria through different kinds of killing mechanisms like oxygen dependent killing, oxygen independent killing, where enzymes are involved, and in this way uh, pathogenesis is propagated. There are different ways of viruses, different ways in which viruses can enter into the body, enter into the lungs, and they can cause viral pneumonia. 200 million cases of viral pneumonia are reported till today. So recently there is a COVID-19 virus, SARS-CoV-2, which is also responsible for causing pneumonia. Apart from these viruses like RSV, rhinovirus, coronavirus, respiratory syncytial virus, adenovirus, influenza virus, parainfluenza viruses, so these are also involved in pneumonia. The main immune cells which will be produced within the interstitium of the lung against these viruses are called alveolar macrophages, and these alveolar macrophages will phagocytose these viruses, and that will result in death of the viruses. But due to viruses escaping mechanisms are present, these viruses in turn inactivate the macrophages, and it can result in spread of infection. The main symptoms of pneumonia, both due to bacteria and viruses, are productive cough. Productive cough means there will be cough with sputum, fever, fatigue, chest pain. So these would be the common symptoms in patients with pneumonia. Now these symptoms were first reported by Hippocrates and later by Maimonides in 12th century, and from then we know this condition. So history is also very important in knowing the condition of the disease. Now coming to aspiration pneumonia. Aspiration pneumonia is caused by different kinds of anaerobes, and these anaerobes can be of the oral cavity or nasal cavity or of the throat that can descend into lungs due to unfavorable conditions, and that can trigger pneumonia. In patients with HIV, with human immunodeficiency virus, when the CD4 cells count below 200 cells per microliter, that can also result in pneumonia, and that is caused mainly by a fungus called PCP, that is Pneumocystis jirovecii. And this fungus can cause an opportunistic, in these patients with HIV, Pneumocystis jirovecii is an opportunistic infection that is causing pneumonia. 400 million deaths are seen annually due to this condition. Now, vaccines and antibiotics both are involved in improving the survival rate in cases of these patients. Diagnosis is based on chest x-ray, CT scan of the lung, culture of the sputum, blood cultures. So these investigations are done before hospitalizing the patient of pneumonia into the clinic. Now vaccines, hand washing, not smoking, these will be forming the preventive measures for pneumonia. The differential diagnosis of pneumonia is based on COPD, bronchial asthma, bronchiectasis, pulmonary edema, pulmonary embolism. So these are some similar conditions which will have symptoms similar to pneumonia. So we have to differentiate clearly based on symptoms, and we have to confirm the diagnosis of pneumonia. Children can also have pneumonia. Children below 5 years of age are prone to have this condition, and they can have different symptoms like there will be decreased level of consciousness, decreased unresponsiveness to drinking, increased convulsions, etc., confusion, etc. The very old people above 75 years of age, and very young people, children that is below 5 years of age, are prone to this condition and are susceptible to this condition in about 70 to 85% of cases. But pneumonia is caused by few strains of bacteria. If there are 100 strains of bacteria, out of 100, only 10% of the strains of those bacteria will cause pneumonia. Now, pneumonia can be community acquired pneumonia, healthcare associated pneumonia, ventilator associated pneumonia. So, in community acquired pneumonia, the pneumonia is spread within the community and it is outside the healthcare facilities. The bacteria which spread community acquired pneumonia in 50% cases are Streptococcus pneumoniae, Haemophilus influenzae in 30% of cases, Chlamydiophila in 13% of cases, Mycoplasma pneumonia in 3% of cases. In Mycoplasma pneumonia, the symptoms can be like swelling of the lymph nodes in the neck, joint pain, and middle ear infection. There is one more bacteria which is not a bacteria, which is a spirochete like Coxella burnetii, that can cause pneumonia and it can spread from farm animals like sheep. Pneumocystis Pseudomonas aeruginosa is spreading infection and it will be responsible for causing pneumonia in cystic fibrosis patients. So patients with autosomal recessive disorder like cystic fibrosis are responsible to spread recurrent infections of pneumonia. Healthcare associated pneumonia, the word healthcare means it is seen in healthcare settings, in different environments of healthcare settings. We can see healthcare associated pneumonia. Now in healthcare associated pneumonia, the pneumonia can be seen within the OP clinics, in the dialysis center, in departments of medical departments, department of oncology. And this is more likely due to multi-drug resistant bacteria which are resistant to multiple antibiotics, and that can be responsible for causing pneumonia. And pneumonia, if a person gets in the hospital, it is 48 hours after admission into the hospital. Now, coming to ventilator associated pneumonia. In 10% cases, people who are on mechanical ventilation, who are respiring through mechanical ventilators, they can also have pneumonia. And in that situation, we have to know which kind of bacteria is involved through microbial cultures, through blood cultures, to sputum cultures. We have to isolate the microorganism and we have to treat it, and that will resolve the ventilator associated pneumonia. Now, coming to the use of antibiotics, there is an acute phase reactant protein which is known as procalcitonin, and if the levels of procalcitonin are zero point 0.5 micrograms per liter to 0.25 micrograms per liter to zero point 0.5 micrograms per liter, then that will be necessitating the use of antibiotics. So antibiotics would be used if the procalcitonin levels are from 0.25 microgram per liter to 0.5 microgram per liter. And microbial cultures will be done in severe cases of pneumonia, in immunosuppression, and in alcoholism, and in HIV patients. So microbial cultures will isolate the microorganisms, and then we can treat the cause by treating the microorganisms. Viral antigens like influenza nucleoprotein antigen, that can also be cultured, and it can also be detected using the polymerase chain reactions. So these are the investigational methods which are involved in diagnosing pneumonia, and more specifically it is starting with chest x-rays. On chest x-rays we can see four radiologic findings of pneumonia. One is lobar pneumonia, other is lobular pneumonia, third is bronchopneumonia, and fourth is interstitial pneumonia. So depending on the location of the lung, the pneumonias are radiologically divided into four kinds, and this will help in diagnosing pneumonia more accurately and more precisely. Imaging should be done in patients who are hydrated. In early stages we cannot detect the pneumonia on chest x-ray. Patients who are unresponsive to treatment, we have to go for chest x-rays in random patterns. And new onset pneumonia, if there is a new onset pneumonia, then also we have to recommend for chest x-ray in patient. Now coming to vaccination part of this story, vaccinations are given against both bacteria and viruses in both adults and children. So in adults and children, they should be vaccinated against bacteria and viruses. And it is believed that vaccinating the children by pneumococcal conjugate vaccine strains have helped in reduction of mortality rates by 11 million. So 11 million children were free of pneumonia when they were vaccinated. This pneumococcal conjugate vaccine, it is very essential, and nowadays it is given in children. It is also given in cases of COPD with a high history of smoking, because they can be prone to pneumonia, and which is a comorbid condition. Immunization in healthcare workers, for example with healthcare associated pneumonia, will decrease the pneumococcal invasion by 74%. Pertussis, varicella, measles vaccine are effective against pneumonia. Drugs like zanamivir and oseltamivir are found to be effective in treating influenza symptoms and bypassing the influenza virus. Stop smoking. Smoking should be stopped, and that will decrease the risk of pneumonia by many folds. Testing for group B streptococcus like Streptococcus A galactiae and Chlamydia trachomatis in pregnant women can decrease the risk of pneumonia in its newborn and infants. Now, how to manage pneumonia? Pneumonia is managed by a CUB 65 score and pneumonia severity index score. Talking about curve 65 score, curve means C for confusion, U for urea more than 7 millimoles per liter, R for respiratory rate more than 60 per minute, and B for blood pressure below 80 upon 60 mmHg, and 65 means age above 65 years. If curve score is 0 to 1, then there is no management required. The person can be at home and he can take home remedies. But if the curve score is 0 to 2, short hospital stays are required, and if the curve score is 3 to 5, there will be mandatory recommendation of hospitalization of patient in clinic or in nursing homes. Children with O2 levels below 90%, they have to be treated with oxygen therapy. In severe pneumonia, we have to admit the patients into ICU, that is the intensive care units. In respiratory failure, we have to use a process of transferring oxygen, that is heated, humidified, high flow oxygen therapy. In circulatory failure, we have to give 30 ml per kg of crystalloids intravenously. Now, the bacterial pneumonia first line treatment is amoxicillin, and this is the first line treatment conventionally known. But alternatives can be doxycycline and clarithromycin. Now, coming to viral pneumonia, we can manage it using neuraminidase inhibitors. Influenza A and influenza B are treated with drugs like oseltamivir and zanamivir. Management of aspiration pneumonia is we have to think which kind of bacteria is responsible, and we can give beta-lactam antibiotics plus metronidazole or clindamycin or aminoglycoside. Now, coming to prognosis, the prognosis of pneumonia is very good in patients who are taking antibiotics, and it can resolve within 4 weeks. The duration for treatment is 7 to 10 days. If any comorbid condition is activated within the human body, then it can take more than 12 weeks. Before the advent of antibiotics, when antibiotics were not there, still the mortality rate was about 30 to 40%, and in that case, without antibiotics, it was difficult to treat pneumonia. Admissions with comorbid conditions like heart failure, brain damage, lung damage, kidney damage can exacerbate the condition of pneumonia. So we have to treat the underlying cause. Suppose if they are diabetics, they must take the metformin, glycomet like medications on right time, and they have to take medications for pneumonia, and that will help them control the disease. As per USA in 2009, pneumonia is considered as 8th leading cause of death. I have talked everything about pneumonia today. What is pneumonia and how does it spread? What are the cells that are involved against pneumonia? Which bacteria are responsible? Which viruses are responsible? So please see this video and understand it, and keep in awareness and spread the awareness about this disease, so that the mortality rates, the morbidity rates get reduced. Thanks for watching. Please subscribe to my channel as much as possible.